Do you know what wellness is? If you said not being ill, you would have given a common answer, but you'd still be wrong. In this video, you'll be introduced to the concept of wellness. Spoiler alert, it's not just the opposite of being sick. Plus, you'll learn the 8 dimensions of wellness. Also, you'll see how a focus on wellness, when incorporated into individual recovery plans, can assist mental health and substance use services. It's a lot of great and practical information. I'm Dr. Richard Hoefer from the University of Texas at Arlington's School of Social Work. With strong support from the Hogg Foundation for Mental Health, I'm presenting information to help you learn more about the recovery treatment movement and what their concepts of recovery are. The purpose of this training is to advance the goal of the Hogg Foundation Recovery to Practice Grant Program. We seek to enhance the implementation of recovery-oriented practice among behavioral health practitioners through participation in comprehensive, discipline-specific training, including for social workers. This information will be helpful to anyone interested in learning about the recovery approach to improving mental health services, whether they are still students or are experienced practitioners. Different definitions of wellness exist. The World Health Organization says that wellness is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The National Wellness Institute indicates that wellness is a conscious, self-directed, and evolving process of achieving full potential. According to Dunn, wellness for people with mental health and substance use conditions is not the absence of disease, illness, or stress, but the presence of purpose in life, active involvement in satisfying work and play, joyful relationships, a healthy body, and living environment, and happiness. Wellness incorporates the mental, emotional, physical, occupational, intellectual, and spiritual aspects of a person's life. A person's overall well-being is a person's wellness. Each individual aspect of wellness can affect a person's overall quality of life. Therefore, it's important to incorporate all 8 dimensions of wellness into recovery. They all directly relate to the quality and longevity of life. We'll look at the 8 dimensions individually. First, there's emotional wellness. This is coping effectively with life and creating satisfying relationships. Next is spiritual wellness. This includes expanding our sense of purpose and meaning in life. Intellectual wellness means recognizing creative abilities and finding ways to expand knowledge and skills. Physical wellness, recognizing the need for physical activity, healthy foods, and sleep. Environmental wellness, good health by occupying pleasant, stimulating environments that support well-being. Financial wellness, satisfaction with current and future financial situations. Occupational wellness, personal satisfaction and enrichment from one's work. And social wellness, developing a sense of connection, belonging, and a well-developed support system. When it comes to health and wellness, those with mental health and substance use conditions face even more types of challenges than those who do not. The 8 dimensions of wellness can help discover underlying causes of these challenges. Research conducted in the 1990s and early 2000s found highly concerning study results that initiated changes throughout the mental health community. The studies found that people with serious mental illness die on average 25 years earlier than the general population, and that they die from preventable illnesses such as cardiovascular and respiratory diseases, diabetes, and suicide at much higher rates than the general population. These studies also found higher rates of modifiable activities such as smoking, obesity, unsafe sexual behavior, and lack of exercise. People with serious mental illness are vulnerable to homelessness, incarceration, victimization, trauma, poverty, unemployment, and isolation. These individuals are more likely to live in shelters and other community residences, which increase their exposure to communicable diseases and poor nutrition. Individuals with serious mental illness also have symptoms and/or medications that mask medical conditions and impact self-care or medical care access. This information was alarming to the mental health services community and prompted hospitals to become non-smoking facilities. They also implemented a host of wellness coaching and exercise programs in mental health services. Vending machines became sources of healthier alternative snacks, and the term wellness became an everyday word in treatment plans. Currently, recovery is becoming a key word in health services. However, some individuals receiving treatment who actively make wellness choices that are seen as bad choices are finding themselves castigated for choosing risky behaviors. Service providers who use such terminology are limiting their clients' choices and self-determination, which are two important factors in recovery. This slide shows the many pathways that lead to a lack of wellness. There are economic factors, trauma, neurobiological factors, and social factors. All of these pathways lead to emotional distress. Emotional distress, in turn, leads to a potential mental illness diagnosis, which is connected to things such as isolation, medication treatment, loss of roles, loss of meaning, poverty, discrimination, and taught helplessness. These all together lead to vulnerability to homelessness, incarceration, victimization, and trauma. They lead to metabolic syndromes, heart disease, diabetes, other health issues. Diagnosing medical conditions as psychiatric conditions is also a danger here, and it leads ultimately to a reduced motivation for a healthy lifestyle. SAMHSA, the Substance Abuse and Mental Health Services Administration, has created a wellness initiative that works towards a future in which people with mental health problems and substance use disorders pursue optimal health and recovery. Many people who have experienced these disorders can achieve a full and satisfying life in the community, especially when they have access to effective services and support systems. The Wellness Initiative encourages people to improve their mental and physical health through positive lifestyle changes. Wellness can improve quality of life and increase years of life, especially for people with behavioral health conditions. Reducing health disparities prevents early death and may also lower the nation's healthcare costs. The Wellness Initiative includes National Wellness Week, which is held during the third week of September, and shares the message that practicing wellness provides an essential foundation for good health. The Pledge for Wellness is a call to action for individuals, providers, organizations, communities, tribes, and states to commit to wellness. Whether through individual behavior changes, community mobilizing, policy changes, or social or familiar support, the Pledge for Wellness is an opportunity to come together and commit to wellness. I encourage you to take the Pledge for Wellness and make a commitment to improve the health and well-being of individuals with serious mental illness or substance abuse. In summary, health and wellness are integral to recovery. Wellness is complex, multi-layered, personal, and has no simple answers. There are many pathways leading away from wellness, but there are also many pathways leading to recovery and wellness. The Wellness Initiative by SAMHSA promotes wellness and recovery and embraces the complex nature of each. Through this initiative, SAMHSA hopes to improve healthcare services and collaboration using educational material distributed by service providers. The initiative seeks to surround individuals with mental health and substance use conditions with supportive knowledge and understanding. With the Pledge for Wellness, SAMHSA is encouraging more involvement and added commitment to wellness by all. In the next video, you'll learn how to make change happen. We'll explore dissatisfaction, hope, and the power of choice as ways to create change for individuals with mental health and substance use conditions.